A very good afternoon to everyone. Thank you for once again joining us for this session. So, today, on behalf of World Optometry Day and Week celebrations, we have a session on Tele-Optometry and AI. And we have a very special guest with us today, that is Ms. Maheshwari. We welcome you, ma'am, for the session. So I would like to introduce Ms. Maheshwari for the session. Ma'am is founder and CEO of Core India Innovations, developing cutting-edge eye care products. And Ma'am is also experienced optometrist with 24 years in clinical practice, academia, and also innovation. She was a former associate professor at Dr. Agarwal's Institute of Optometry, and also she has contributed to many numerous publications as author and co-author, and she has also presented in many conferences. She also holds patents for innovative eye care devices. Ma'am is also a fellow of IACL and ASCO. So we welcome you for the session, ma'am.
Yeah. Thank you so much for the introduction. So I'm just trying to stop share this. So good afternoon and a very happy optometry day to all of you. So happy to meet you all during the optometry day week. So it's an immense pleasure to to talk anything about optometry day and anything for optometry. So what I will be doing today is I'll be talking about generally what is the telemedicine need is there and what are the other devices that is there in the telemedicine. So I'll just give a glimpse of what all tele-optometry, so what all is happening in the field, and then I'll be talking about especially about the instrument which I am developing, and also I'll be talking about the huge opportunity that is there in the optometry field. So, so at the end of the session, I have planned how to give you some idea about the opportunity that is existing. Normally, in the eye care, we say that there is no big opportunity, or there is no big hike in the salary, or the businesses are less because of the corporate environment and all that we are saying. But there's a huge opportunity that is waiting, that huge market that is waiting. So I'm going to talk about that at the end of my session, and also I'll also be giving which are the field that will be trending, right? Starting from today, what is going to be the trending one in the next 10 years? So that's the idea of today's talk. So, and I also, okay, good. 32 participants are here. Very happy to welcome you all. And I'll be starting the session. Probably in between, we'll stop and then discuss. So we are, how much time we have? We have 1 hour, right?
Yes, ma'am. We can go ahead. We'll have 40 to 45 minutes for the session, and then we can take questions, ma'am. Is that okay?
Share your screen. Okay, so hope you can all see my screen, right?
Yes, ma'am.
So, looking at teleoptometry, any device which is coming out as a teleoptometry device, so we can say that no, it's going to be portable, it is going to be less invasive, and it's going to be automated. So, and then it is no, it is cloud connected. Okay, so telemedicine means it's a cloud connected one. So this is how innovations are happening in the teleoptometry industry. Okay, so just to give you an example, and before I started my company, Core Idea Innovations, I was working in Dr. Agarwal's Eye Hospital, where we formed a company from Dr. Agarwal's Institute. We have we set up a separate innovation department, which is ELISAR Vision Technology, where I was involved into the product development of this particular device. This is called ELISAR Advanced Visual Field Analyzer. So I worked only on this product for around 3.5 years, from 2017 to uh, 2020. So I was working on this product development for around 3.5 years. So it was a huge opportunity, and it was very exciting to see such a big machine. No, when you take this machine, Humphrey Visual Field Analyzer, this is weighing around 50 kg. Okay, so 50 kg. Okay, so the instrument that was developed later by our team. So this is weighing around 500 grams. Okay, so half kg. Okay, so you can easily put it in a bag and carry this. Once you make it portable, then we can take it anywhere and take the report. And if in the Humphrey Visual Field Analyzer, you can't sorry, you can't send a email. Okay, so now we have, you can send the report by email, or you can send the report by WhatsApp. So this is what is happening in the ophthalmic industry now. So any medical industry, now people are trying to make the devices portable. Once you make it portable, you can easily take it to the patient's home. Okay, once you take it to the patient's home and do the develop this, and then directly send the report to the doctor, and then doctor sees this, and he no he just gives the uh, a report. Okay, so just a second. Once again. Okay, just okay. Sorry. Okay, so it's the report, so that what can be done. So the report alone can be sent to the ophthalmologist, and optometrist goes to the patient home, and then they can connect it, and then gives the sees the perimetry report, and then he through online consultations he can give the solution to the patient. Okay, so the this is how the industry itself is evolving. For every instrument, a portable instrument is developing. Okay, so this is again another example. Again, it's an Indian made innovation, Ortilus OCT. So already we have something called Cirrus HD OCT, which is from the Zeiss. It's a very big, bulky device, and now we have made in India Ortilus OCT. So this is portable. So with these innovations, again, you know, it is not only becoming portable; it is also becoming cost effective. So the cost of the device is also coming down very nicely in terms of when you're making it in India. Okay, so and looking at how we are measuring the visual acuity and how we are doing refraction, we all know that it is mandatory to have a 6 meters room. Okay, and we use a mirror to make it 3 meters, and still we need a 3 meters room, um, and this cannot be done through online. So measuring visual acuity and measuring refraction, we cannot do it through online. So this was a big problem that I thought, okay, let me take it and then work on it. Okay, so this is the idea that we have taken in our company. So what we thought is how to do something for tele refraction. Okay, So I've been working on this for the past 3.5 years, only on this, developing this. So what we thought is we will develop a virtual reality based visual acuity system where you can control everything over the cloud, and then you can measure your visual acuity and you can still do the refraction. So this is what is our innovation. So before going to our innovation, I'll just give you a brief background of what is this virtual reality thing about it. So there are many challenges, when we are working on this device. So see, now I want to have a 6 meter system inside the virtual reality system. So if you see that the challenge is there is no standard method. There is no standard method for custom making the virtual reality optics. For example, when you just go and buy some virtual reality, you can even order from Amazon. Uh, you can order a virtual reality device, and then you can use it and then see how you can play games with all that. Okay, but if I want to make a custom make design of a virtual reality, because if you purchase any amazing virtual reality, okay, once again, um, okay, let me stop share. Okay, so have you ever in the audience, have you ever tried a virtual reality device or playing game?
Yes, ma'am.
You,
We tried the first you saw the Humphrey Field analyzer, the remote portable like that. And I'm also working from Dr. Agarwal Eye Hospital. So I see in
okay,
CMH brand, I think you
okay,
know main brands I'll work with. So I work on
okay,
it. So it's
okay,
pretty
okay,
good.
okay,
I impressed with
okay,
that first
okay,
time I see.
okay, 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 very good.
Myself, Gokul Prasad, sorry to introduce.
Okay, 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 nice,
Okay.
nice. Just a second.
So, meanwhile, all of you can even put in the chat box if there's any question asked, or if you have any questions to ask, ma'am, also you can put in the chat box. This is for the participants.
Okay, so I'm asking about the normal VR games headset. So anyone
Yes,
has tried?
my name is Kausar. Even we have tried a portable refractor, in which like subject to refractor, in which you can do tele-refraction. Example, if I'm in India, and we can do a refraction in USA.
Okay, 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 okay. So this is from which company?
It's for us help. So we already
Okay,
launched it as in USA this year.
okay, okay, okay.
It's
So this
based
is
on a
the one
liquid
where
lens technology.
it's like a four-opter, right?
It's a headband based phoropter, it's very small
Okay.
portable device
I've seen,
where you are
but
changing the lenses with the help of liquid lens technology, not
okay,
physical lenses. Yeah.
okay, okay. So, but where do the patients see? They'll look at the distance.
No, actually, we are already working on the chart where they have visual, like a virtual reality chart, it's small chart, like a
Okay, the
small
chart is
system.
located.
It's
Chart is
inside
located
it's
where?
embedded in the system.
Okay, chart is embedded in the system. Okay,
Yeah.
okay, okay.
Yeah.
So I was okay. All of you are talking so technical. So I was just talking about this games, the VR gaming thing. No, so when you are working on the VR games, so
Yeah.
you will see this. It is simulated to around 60 centimeters or 1 meters maximum,
Yeah.
right? Okay. So there is some complexity in bringing it to 6 meters. Okay, so that's what I'm trying to convey. So the challenges in this development is to make it 6 meters. Okay, so you all know this B by U formula where when you increase, if you want to decrease the magnification, magnification is equal to V by U, right? So if you want to decrease the magnification, either you have to decrease the V value is 6 meters, you can't do anything, and U value is um, uh, no, it is adjustable, anything that you can have. Okay, so if you want to decrease the magnification, if you can increase the U value, or the entire instrument becomes so big, right? So there is a huge magnification and pixelation in that. Okay, so whether we have to use a phone or we have to use a display and all that. So these are the issues in bringing it into a virtual reality base. So these are my personal experience of working with the virtual reality and then creating it. Okay. So there is an attempt from this Singapore University. So they have tried to use a virtual reality head-mounted display for measuring the visual acuity. So what they mentioned, in this paper. So what they mention is, as I told you already, so they say there is a significant drawbacks. As a previous preliminary study we conducted using virtual reality, a smartphone to test for visual acuity revealed technical challenges. Okay, so let's see what are all the challenges that they faced. So there is a screen door effect, and there is an artifact, and there is subpixels. Okay, so hope you understand this subpixels, because when you're working on the virtual reality, there's a huge magnification. Okay, so because of the lens, because the lens that we are using it to create a virtual image, and on top of that, it's also creating a magnification. So because of that, it's creating big magnification. Okay, so because of this huge magnification, what happens is you will tend to see the pixels. So whatever phone that we are using, so whatever is the phone, okay, so whatever high quality phone, so it will create pixels. So it will be of low resolution, and all phones having low resolution, so it will create subpixels. Okay, so this is what is their observation, and they tried an augmented reality. Because why I'm telling you all this is because people want to create any other alternative, because it's a big burden of the patient coming to the hospital, and you need to have a physical space, and again you need to give 3 meter space for anybody to test the vision, right? So because of this, everybody is trying to create some alternative technology, virtual reality, or alternative augmented reality. So everybody wants to create an alternative system where they want to create uh, um, a portable one. So if it is portable one, you can easily cloud connect it and work on it. So that's about it. So this is another innovation from Remedio. Okay, so hope you all know the company Remedio. So what they have done is, you can see it's a huge instrument. It is only for changing the lens, and you have 3 meters across here, and you have the optotypes for visual acuity testing and the refraction, which will be displayed in this display. And then you have a computer system here where the ophthalmologist or optometrist will appear here over the video call, and then they can see you from anywhere else, and then they can control this remotely and change the lenses, and they can also hear when the patient is reading their alphabets, optotypes from 660 to 66, and then they can change it through online. I'll say it's an excellent innovation, but it is not removing the need, because it's why it is not removing the why is it not very useful in terms of teleoptometry. Can you comment on this device, any of you? You understood what is this device? So the optometrist is not required to be here physically. Okay, so for example, you have you have one clinic in one city. Say for example, you have one clinic in Delhi. You want to have open another clinic in Mumbai. So what you can do is you can just buy this and keep it there, and then from this clinic you can do the refraction for that clinic, and then you can still do the refraction through online. You can connect it and do it. So need good net connectivity, space required. Okay, good, Jyoti Thomas, very good. Okay, so yes, again, again we are ending up with a bulky device, and again there is a internet connectivity is required. So nowadays we have internet connectivity everywhere, but still, to change the lenses and all that, we need to have a very simple instrument so that the internet also, if it should change quickly. Okay. So okay, so this is the instrument that we have developed in our company. So this is a virtual reality auto refractometer. Okay. So okay, so is this 4-opter? Somebody is asking, is this 4-opter? So if it is about the previous image, binocular AR, yeah, okay. So if this is about this is not a 4-opter, or this is not an auto refractometer. Okay, so this instrument is only for changing the lenses. Okay, so it's like, you insert the lenses and remove it. So this entire instrument is to change the lenses. Somewhat it's like a 4-opter only. Okay, but automated 4-opter. Okay, so you can control it from distance. It's similar to 4-opter, but difference is we can operate it from anywhere. Yes, yes, very good. Okay, so what we have done is, so this is the one that we have developed. Okay, so the advantage of this is, we have overcome this problem of high magnification. We have overcome this problem of this pixelation, and you have 6 meters. When you're looking at inside, you have 6 meters. So as I told you, we also faced a lot of problem of magnification and pixelation. And then we have worked with various displays and various optics, and then finally we arrived at a successful 6 meters simulation where we have connected it with the cloud. Okay, so the biggest advantage when compared to this instrument is it's this portable. Okay, so you can take it and then keep it in your laptop bag and then carry this to the patient. So this is the advantage of this device that we have developed. So just to give you a feel of it, I'll just show you some video of one video of this. So what I'm doing in this video, actually we have done a camp using this. But anyway, it's a portable device, but somebody needs to take it to the patient's home. Okay, so what we did is, it's an interior village where there are no eye hospitals. It's a village inside Tamil Nadu where I sent the device to a person where we connected this over online, and the person was holding the device in the hand, and then I was doing refraction. So we just spoke to one family, and we thought 4 or 5 people will be there, and then because we also wanted to check how our device is working. So it was very interesting to see this, all the people in that village assembled in that area. So around 20-30 people assembled, and they all showed interest. And then I was doing refraction. Around 10 people got refractive error, and I have prescribed glasses for them. Around 6 people bought the glasses. They selected the frame, and then it came back to us, and then we fixed the lenses, and then we courier the spectacles to them. So it was an exciting experience. The disadvantages, again, you have to carry this wherever you have to go there. But the greatest advantage is the optometrist need not travel to the concerned place. So you can send any non-optometric person who can just connect it so that you can, from the distance, you can measure visual acuity and you can do the subjective refraction. So at this point, I'm making it clear, we are also using an autorefractometer, which is not our innovation. Okay. So we are also using an autorefractometer, which is from a different company. Okay. So we are using our device along with the autorefractometer, and then we are coming out with the refraction value. So I'll just show the video.
எப்படிங்க உங்களுக்கு பார்வை எப்படி இருக்கு உங்களுக்கு?
சரியா தெரிய மாட்டேங்குது.
இப்போ
GTVJHOQR.
இப்ப படிங்க.
So what you saw in this video is I have a display where I am changing the optotypes by clicking it. I'm also changing from right eye to left eye to right eye, and then both the eyes I can select. So I can also select the optotypes, which type of optotype, whether it's a tumbling E or numbers or the English alphabet or a logmark, whatever it is, I can select it and then display to them. And I'm also changing the size of the optotype, and also I can change from right to left. So and once I measure the visual acuity, then I'll tell them to do the autorefractometer. And then the what we have done in our company is that we have spoken to the autorefractometer company, and we have connected the results of the autorefractometer into the cloud system, and then so that the autorefractometer readings will come to my page. Okay, so we have created, so we also have an extensive software working along with this. So what will happen is, if somebody is doing an autorefractometer, it's a portable one that we are using. So from autorefractometer, the values will directly come to my page because we have done a cloud connect. And this is also entirely cloud connected. And so we have worked extensively for reducing the load so that it will be very fast. Okay, so I am sitting in one city and the patient is sitting in another city. When I am clicking it, it just changes very fast because of we have done a lot of work in reducing the data usage so that it happens very fast. So the moment I click, it changes quickly, so it's happening very fast. I'm getting one question: can we use this without the internet? Internet is mandatory. Yes, I'm sorry for this. Regarding pixel, okay, somebody is asking, how did you solve the problem of pixel? That is the thing that I worked for so many years, and then I removed that problem. And how we remove the problem of pixel is, that is what I patented this. It's a trick, it's an optics trick that I used, and I cannot reveal this because it's one of the confidential information in our company. So if I reveal that, everybody will make it. So that's a unique thing about our instrument. So if you have any questions regarding how I was doing the refraction, maybe you can ask now. Okay, I'll just proceed. Okay. Okay. So how is the power changing? We are actually inserting the lenses by hand. It is manually we are doing, and we also train the person on how to take the lenses and insert it. So we do a manual insertion and removal of the lenses. So the cost is around 1 lakh now, and right now it's our new device. We are not charging for the software. So this is for the time being. Okay, so we are like now only we are going to the market. So we are just at the verge of completing the manufacturing and going to the market. So from today for around 6 months, the rates will be this. Okay. So I'll go to the next slide. Good that you people are interacting a lot. Okay. So uh, so you must be knowing this, no, for amblyopia. So the very boring form of therapy is, patching this. Now also for amblyopia also we have the therapy which is coming. You can you have a VR based devices where we have this Neurasim. You must have heard Neurasim from Dr. Ramesh's company, where they have this virtual reality based therapy for instead of patching, if you can use this, it makes the children happy and they are motivated to do the exercise. And also you need not do this painful patching. And what you can do is you can send it to the patient's home. So home therapy is possible, and you can have a cloud connected data, so that the ophthalmologist or optometrist who is sitting in the clinic, we can still see. Okay, thank you. Okay, somebody has written it's a very good product. Okay. Okay, so I will so this can also be used for teleoptometry. Okay. So so this is another innovation which I was very impressed from Remedio. I was seeing it. This is eliminating the need of dilatation. Okay, so it is around 125 degrees of image capture of the retina. It's a big bulky instrument. So 125 degrees of image capture is happening without the dilatation. Okay, so it would solve the big problem of um, putting the drops and getting blurred for 24 hours. So and because of this, what you can do is, because we are also talking about AI today. So one interesting thing about this Google Health, so what they have done is they have taken a lot of data, and then they are licensing it. They are giving the license. They have the software and they are giving the license to many instrument companies. Okay. So for example, Forest Health and Aerolab, Perceptra. So these companies and all, so they are paying money to Google and then purchasing it this license, and then they are, you know, when they are selling their fundus camera, so they are also giving this as an additional feature where you can use AI and then do the diagnosis. So in this case, even an ophthalmologist is not a mandatory thing. Okay, so they can just click on the image and then they can do an AI. They can run the AIs and then they can see the diagnosis. And if it is normal, you can send the patients home. And if there is anything abnormal, then only they have to refer to an ophthalmologist. So not only, so this is a big one, but the Remedio has a portable fundus camera also. Forus is also having a portable fundus camera. So even that is connected with the AI. Okay, so you can click the picture and then send and then do an AI diagnosis. And if the AI is saying normal, you can send the patient home. And if it is abnormal, and if it is giving you a diagnosis, then you can refer the patient to the eye hospital. Okay, so this is about the AI. And there are other innovations which are automatic, other AI based innovations which are automatically measuring the IOP using some sensor and all this. So this is a bit complicated, but it is FDA approved. Okay, so you can say this triggerfish sensor is a first FDA approved device, which can monitor 24 hours IOP. So available in US, not yet in India. So so now I'll be moving on to the opportunities. Great, great. Okay. So you can see from the image itself, you can see that the huge opportunities that is coming up. When you see how in 2017 till today, how this market opportunity in the revenue generation in online consultations. So you can see how online consultation, it keeps on increasing. So you are seeing some numbers, right? 138, 183. So these are all million US dollar. Okay. So that means 2024 is 183 million US dollar. Okay. So you can see that it keeps increasing if you look at 2028 data, so the projected one, so what will happen in 2028? Whatever is happening now in 2025 or whatever has happened in 2024, it's going to double. Okay. So you can see how it is increasing, how this is going to double. So these online consultations or home-based consultations, the need keeps increasing and it becomes, this is an Indian data. Okay. So I'm not talking about US or world data. This is an Indian data. So you can see that whatever is the opportunity that is existing now, that's become double. Okay. In 2028. So when you are planning your future, right from today, another 5 years, 10 years, please work upon this teleoptometry or home-based eye care that is going to dominate the industry. Okay. So coming at the home healthcare market, this is the world data. Okay. So world data. So what they are projecting is in 2031 or 2030. So this is going to become 685 billion US dollars. Okay. So whatever is happening, okay. So whatever is there now, it's going to around 30% increase in 2030. Okay. So you can see that there's a huge potential for the growth in the home healthcare market. Okay. So, okay. So coming on to this is again, this is a data from, it's an data for India. Okay, so what home healthcare will do. Okay, so whatever was happening in 2022, it is not only doubled, more than double. Okay, so it's going to become 15 uh, billion US dollars. Okay, so in 2030, so I'm just telling you big money because huge money is involved. So as usual, some corporate company will come and take it up. So I'm advising you people to know how you can start your own business because market is good. Okay, so you know very well for sure the market is good. You can start your own business because from in 2030 it's going to become 15 billion US dollars. So this is an Indian data, right? And okay, so I just calculated this. See, if roughly if 180 billion US dollar is for the total healthcare market, and from that 67 billion US dollars is a world data. Okay, so 67 billion US dollars for the total eye care market. Okay, so then I was just calculating home care and home eye care market. So it comes around. This is again Indian data. So in Indian data, what you see here is 5.5 billion US dollars. It's a very big market. Okay, so 5.5 billion. I'm not telling million. 5.5 billion US dollars for home eye care market. So this big market, who's playing in this big market? I would say nobody is playing. Okay, so it's an untapped one because we do not have enough innovation. It's coming up now and people have not started using it. So we do not have enough innovations. So this 5.5 billion US dollar market is untapped. Okay, so nobody is playing in this market. Okay, why nobody is playing in this market? So maybe you can ask me already. Lenskart is doing home eye care, or Shankar Netralaya is doing home eye care, or LBPI is doing home eye care. So they are no, I've also calculated how much they are. So they've not even taken 1% of this big market, no, $5.5 billion US dollars, because I have manually calculated everything and then I'm talking. I'm not simply talking from any theory. So each and everything I have taken and manually calculated and how much of market the people have taken. So I have calculated, and I'm saying is out of 5.5 billion US dollars, Lenskart or specs makers, whoever is working on the home eye care segment, they have not even taken 1% of the huge market that is available because of the lack of manpower. We do not have enough optometrists and ophthalmologists, so we are not able to tap this market. So now that we have a lot of instruments for tele-optometry, and people should learn and then they should start using it, so that there is a huge market that is available that we can use for our use. Okay. So I'll just tell you some future tips. If you are into innovation or if you want to bring out any new ideas, please work on myopia and dry eye. Is going to be a big market in future. Okay, so 50% of the India will become myopic. We know that, and already 70% of the population will already they are having dry eye. Okay, so any innovations related to myopia, any innovations related to dry eye, anything that you make it portable. Just to give you an example, portable A scan. Okay, so that will be a future trend. Okay, so already portable A scan is somebody is doing the beautiful drawing. So if you can see and remove it, yeah, thank you. So if some innovations like you can go and give some therapy to dry eye at home. So you can go and do some axial length measurement at home. So that will be a trending innovation in the upcoming few years. Okay, so if you are into innovation, or such kind of innovations will come, or you can work on that, or portable topographer will have a future trend. Already many companies are working on portable topographers. Okay, so with this, my talk is over. I think there are some questions which I missed between. Let me see. Okay, so ma'am, the Neuralink is have eyesight and partially blind. The machine having a giving visual through mission. Basically under developing by Elon Musk. Okay. Any thought about it? Uh, the one which Elon Musk is developing. So as you are also reading it, I'm also reading it. I do not have any idea about it. So I'm also excited like you to know what it is. Okay.
So, ma'am, majorly what participants would like to know is what would be the costing range of the product that you were talking in the this thing is one question in the chat box, ma'am.
Okay, okay. So my product cost. It's the devices to Okay, so if you're asking about the cost of my product now it is 1 lakh. Okay, so we are it is at a very very low cost, and for the next 6 months we are not charging any cloud cost or software cost since we are at the beginning. Okay, so this is about the cost of our device. And that answers the question. Can you provide any certificate for attending this meeting? So you have to answer this certificate for this meeting.
Gokul, this is just an informative session. Please write to us on info@ocindia.org and we'll let you know. Okay. I'll just put the email ID here.
Okay, so what is the weight of virtual reality device? Weight is around 600 grams. We are still trying to reduce the weight of it. Any other questions which I missed?
Also, participants, you can unmute yourself and maybe ask the questions to ma'am. Meanwhile, I would request the participants to turn on your camera so that we all can take a picture together for the session.
Ma'am, how you are changing power in the device?
Okay, so the power in the device, as I already mentioned, you can what we are doing is we are using a manual drive frame and manually inserting and removing it. So,
Then
and we are having a physical session in Chennai where we are physically demonstrating this device. That's going to happen in March 30th.
So when I mean to say, you said like we can do it remotely. So that means in front of patient, somebody has to change the power, or you are going to change it somewhere.
Yeah, so what we are doing is we have one guy who's going to the patient's home. Okay, so this guy is carrying a bag. So in that bag, he carries a trial lenses, a smaller one, and then he's also carrying a trial frame, and he's also carrying a portable auto refractometer, and then he's carrying our virtual reality instrument to the patient's home. So we all made it like a one single bag where everything is reduced to weight. So he carries to the patient's home where this guy is connecting the hotspot with. So this guy is not an optometrist. Somebody who is going to the patient's home is not an optometrist. He connects everything, and then the optometrist connects over online, and then the optometrist gives instruction or no, put minus 1.25 minus 1 like this. So this guy removes and then changes it manually. Okay, so we wish to do this um, automatically, but right now we are having a manual insertion. And also, I've given my phone number in the chat box. Okay, so if you want to know more details about our device, you can WhatsApp me. Please do not call me. Okay, so you can WhatsApp me that I attended your session. I want more details about your device. Probably I can share my uh, video and then brochure and any other invite in our company. Probably we can share that.
Ma'am, I have one question. This is Abdul, ma'am.
Yes, yes.
You have many researchers and found this device, right? So, according to you, what are the contraindications till now you're facing, and you cannot solve that according to you? The
I didn't get
contraindication which
your
was
question.
the contraindication which was still it is existing in your device.
Contraindications for our device.
Yeah.
Okay. This is
What all facing by yourself? Because normally, if optometrist in person, if you are going for any camps or in clinical setups, because of the interactions between the patients, it is easy to convey everything in subjective refraction. So actually, refraction is the interaction thing, which is more important for that, right? In your device, there is interaction, but if the patient is not cooperative, in person we can do retinoscopy and finalize the power, but in this
understood.
condition we cannot do that.
I got your question. Very good question. Uh, so is the one-on-one, emotionally the patient can connect with the clinician? That's your question, right?
Yes,
And
yes.
also sometimes when the patient is not cooperating, how do we deal with this? Okay. So it's a very good question. So what we have experienced it. So we have done a clinical trial for 150 patients, and after that, what we have done is we have done a field trial. Okay, so where we went to 200 homes. So far, we have gone to 200 homes where we connect with the patients and then we do the eye testing. So right now, one of the optometrists is using our device. So now we are doing the market study. How people are. So we have gone to 200 patient homes, and then in Eiffel Optometry Clinic, Savita is using our device. So what she is doing is she's giving Facebook ads and Insta ads, and then people are coming and they are booking for home eye testing, and then the guy is going to the patient's home, and then she's booking orders, she's earning extra income, and all that is happening. So in all these, we have experienced that patients are not thinking that only there is an online. Do I have a connect? So this barrier is there only in the optometrist mind. Patients do not have this barrier. Okay, so this is what we have experienced. And things will rapidly change. Previously we were never thinking of we have to go to the hotel and eat. Okay, we never thought of Zomato or Swiggy. Now it has become, if you want to eat, you have to take your phone and order from your app. Okay, so this is, whether we accept it or not, it is there in our mind. Whether we accept it or not, this is going to happen. Okay, so this is a change of technology. This is going to happen all over. So whether we are getting adapted to it or not, that's a question. Okay, so sooner we take up the technology and then move forward with the flow of the trend, we will be on the track. Otherwise, we will be lost out of the track. Okay. So as far as the emotional connection is concerned, see, in one place where I have experienced is, people became very happy. They are becoming more respectful because, if you go there in person, they will not respect you, but no, they are seeing you online, so they are more respectful. Okay, so the place I told you, the Bear Village, so everybody was like, no, 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 he is there available online. So they went and called all their neighbors also. No, somebody is online. They've come for testing, and this guy who went there for with a bag, so they did the pickup and drop from the bus stop, and they gave him lunch, everything. So around 15-20 people gathered, and it was very emotionally overwhelming. Okay, so already, we were having that Zoom call and all that. We got used to it. Still, we cannot stop the rise of technology. Sorry for the long answer. Uh, yes. Okay. Will you give EMC and CMC? What is it? EMC and CMC means? I don't understand what is EMC and CMC. Thank you, Sneha, for your feedback. What is the accuracy of your device out of 100 patients? Okay. So, the accuracy level, see, normally when we see, what is the accuracy level, we say 90%, 95%, 98%. Here we cannot say 98% also, we cannot say 99% also, because it should exactly match, because it's a spectacle power. Okay, if it is 3.25, it should be 3.25. Okay, you cannot say 99% accuracy, you cannot say that. Okay, so it should be exactly the same. And we have got 0.97 of correlation with the linear regression and with the ICC. Okay, so we couldn't plot the bland altman because most of the values are exactly the same. Okay, so this is that accurate. Okay, so I have my linear regression graph and bland altman. We have submitted it for publication. It's going to get published soon.
Okay,
Thank you so
thanks,
much,
ma'am.
ma'am.
Thanks, ma'am.
We are so happy to hear about the new innovation, especially the device that you had worked on and you had shown on the patients, etc. It was really very informative session, and thank you all of you participants for joining today's session. So any further questions, I have put the email ID in the chat box. You all can connect with us so that we can connect with
Uh,
ma'am.
have we taken this snapshot? Screenshot you have taken?
Yes, ma'am. So everybody can you just turn on your camera so that we can take one picture.
Hi, Maheshwari.
Hi, hi, hi. Hi, Pala. How are you?
Yeah, I'm good. I'm good. Thank you. Thank you for joining. Yeah. So, Maheshwari,
Okay,
you
thank you.
remember when you came to the OCI
Yes,
office, we
yes,
were discussing
yes,
that some of our members can actually try the
yes,
device.
yes, 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 yes,
So
yes.
maybe
Okay, okay.
to all of them who are currently who have currently joined us, maybe we will connect with you later.
Yes, yes.
We
What we
also
can do
are,
is,
yeah.
I have given my number here, or
Mm,
Pala, you can also, maybe a WhatsApp group or something like that. So,
right.
and we can also give devices for a rental basis. If you are a practitioner, I can give it as a in rental basis for you to try it out and then think of purchasing it later.
So the idea is basically to reach more and more people. If you have your own practice, what happens sometimes is you can't leave your practice and go for these community activities or home eye test. Maybe some geriatric patient is there and you can't go. So that is what me and we, Maheshwari, were discussing, that if you have your own practice towards the rural areas or semi-urban areas, then maybe you can test this device, try this device for a month or so on a rent basis. and see if you can reach out more patients, like how home eye testing is becoming more and more popular. So you can also kind of try out this device. You can use one of your staff only to go to someone's home, and you can be the person who is sitting in the clinic and doing the refraction. It's a good innovation. Maybe OCI will come up with some more ideas and share with you. But
Yes, yes,
keep connecting with us. Yeah, keep connected with us. We will send you information emails. And if you have any more information which you want to ask Maheshwari, then connect with us and we'll help you answer that.
So we can always help you people, and no, Pala was telling that day, no, there are some good practitioners who are here in the OCI group where you are having your own practice. No, even in the rural areas, you people are serving. So what Pala was telling is to encourage all you optometrists, no, to expand your reach. So we can specifically conduct meetings, or we can do a one-on-one meeting to show the demo of the device, so we can see, we can come together and see how we can help each other. And as I told you, this will be a good opportunity that before buying it, you can rent, you can use it for a as a rental basis, and then you can try it out, and we can discuss it further. So Pala will help you further in this. Thank you, Pala, for reminding me this.
Yeah. Thank you, everybody. Yeah, can we have some of your videos on so that we can take some screenshots? I know it's an afternoon session, but still we are 40 here. So thank you, everybody, for joining.
Yeah. So thank you, Maheshwari ma'am. Thank you, everyone, for joining the session. We'll wind up with today's session. Thank you so much.
Thank you.
Okay, thanks, ma'am.
Thank you.
Bye.
Thank you, ma'am.
Thank you, ma'am. Thanks.